All right, so welcome to episode 6. We are going to be talking about a very important topic today, hairlines. Okay, this is the thing that is very controversial, and we want to get into it because we want you to be able to make the right decisions when you're thinking about hair restoration surgery to bringing your hairline lower or adjusting it, and what are the correct landmarks, right? So take it away. Give us an example of someone coming in and they have, let's say, well, I'll give you the example and you tell me how you would want to treat it.
Sure.
But recessed hairline, they call it a widow's peak, right? The central portion is still pretty stable, needs some improvement, but there are hairs there, but the corners have kind of gone up. How do you approach?
There's multiple things to think about in terms of how much donor hair they have, their age, how much future hair loss progression you think they're going to have. And then it's kind of a conversation of what's appropriate to do. We don't want to lower things in a way where it's going to look unnatural in the future, for example, or where we use so much hair to lower the hairline aggressively that there won't be hair if they have future hair loss progression. So then they end up in a situation where they have this really dense, packed, low hairline and then all this hair loss and an unnatural pattern and that kind of thing. So There's a lot of different things to consider. I think in having that conversation, common things that will come up will be wanting some natural asymmetry. So I think sometimes patients want it to be completely symmetric, but when we talk about making things look natural and not they maybe even have a hairpiece or something like that, we really want to make sure that things are actually a little bit asymmetric. And you can get a sense, because everyone has facial asymmetry, their skull shape is going to be asymmetric. So you want to honor what they're doing naturally. If naturally one side of the hairline is slightly lower than the other, you can try to honor that. Maybe you adjust it a little so it's not as asymmetric, or you adjust it a lot so it's not so asymmetric, but keeping some degree of asymmetry. And there are cases if people want a really rounded hairline and that is appropriate in their case, then maybe you do want it to be more on the symmetric side. But that's always something that comes up, is the idea of making things look natural by there being some asymmetry and also following what was there or is there naturally. And then also the irregularity. So I think a lot of times people think it should just be a straight line, but you actually want macro, so bigger things of irregularity and small amounts of irregularity.
So let's break it down a little bit, because there's a lot of information to unpack, right?
Yeah.
So you gave 2 examples. You said first it should utilize, correct landmarks and aesthetics that are individualistic, right? So all of the time on marketing now, I see folks utilizing a laser to create a hairline. And that sounds cool, it looks cool, visually appealing, because you're like, oh, that's technology. But no one should have a cookie cutter hairline as the next person.
Right.
And that's the biggest issue I see coming out of overseas, or folks that don't understand the aesthetics component. Everyone's hairline looks the same. So that's point number 1. So well taken.
So everyone's hairline in the real world is very different. But the hair transplants in certain practices all look the same.
Right.
Which is not going to look natural.
Right. And so let's break down a little bit of the landmarks before we go on to the next topic, which is kind of planning based on age and what is appropriate, but also keeps enough donor intact so that you can cover other areas of hair loss. So going back to topic number 1, what are those landmarks? So I can take it off. Here, the way we learned and the way we practice are utilizing the muscles of the face and facial expression to identify the middle portion. So, for example, I will break the rule, but if you're watching on YouTube, see if my wrinkles, basically, if my hairline moves with my wrinkles, that's a bad job, right?
Yeah.
And so it should be 1 finger breadth above the topmost wrinkle. And that's the central portion that I like.
Yeah.
Right, at least. And a lot of times folks will have little baby hairs there, and those can be utilized as like a cheat sheet.
Yeah.
Right.
I use that a lot, actually.
Right.
I mean, so you can, there's different, there's so many, it's such a science and an art. So you're going to find people that use all kinds of different techniques in designing a hairline and use different rules. Like
Right.
this many centimeters above this point, there should be the hairline. Or some people know, for example, they know how many centimeters their hand is.
Like their four fingers.
Their 4 fingers, but everyone's 4 fingers are going to be different,
Like,
right?
I have fatter, bigger hands than you.
Right. So there's different things you can do, and those are all good guidelines. Even
Right.
though laser can be an okay guideline, but you
Right.
then need to be customizing it to the person.
Right. And then, we talked about the measurement. We've talked about kind of the anatomic variation based on movement of muscles.
Yeah, then that comes up a lot. Like sometimes people will be like, I want my hairline down here.
Right.
And I'm like, can you move? And there's some movement there. And I have to explain to them, like, that's still your forehead.
Right.
There's still frontalis muscle there.
Right.
And it's going to look really unnatural if you're making facial expressions and your hairline is moving around.
Right. The last one I'll mention is if you turn a patient to their side profile, and it's basically, imagine a line coming from the top, horizontal, and a vertical line coming from, the front of the face, and it's really where that intersection of those two lines are. That's where the curvature basically is like at a horizon, and you can start your hairline there. And if it's too low, it's going to look abnormal, and if it's too high, it's also going to look abnormal. So there are multiple ways to look at it. Mm-hmm. This is the type of education you need to ask for when you're going to your transplant consultation.
And you don't need to necessarily understand how they're coming up with your hairline, because again, there's many different ways of doing it. And I think as long as the end result is something reasonable and natural, how you get there is okay.
Right.
But I think it's something to really look at when you're looking at their work. Like when you're looking at before and afters, you need to be looking at, does that look natural? And also when they're talking to you, are they planning for the future as well, basically?
Again, before we go into that topic now, let's go back to the anatomic landmarks, and we'll break it into the types of hairline, right? So there are male patterned hairlines, there are female patterned hairlines, there are ambiguous hairlines, there are transitioning hairlines, right? So I can talk about topic number one, let's say male patterned hairlines, right? And so when I plan that, I basically take the lateral portion of the eye and draw an imaginary line up to the temple on either side. And that's the point at which the side corner should touch, this angle. And then a lot of times patients will say, well, I want a flat connection between the central portion and that side. And I'll tell them that
will depend on ethnicity and other things too.
Sure.
Yeah.
But that is where you need to embrace some level of recession, right? So it is completely normal. Even the people with the best heads of hair that have never had a transplant, that have quote unquote no hair loss, they'll still have a little bit of natural receding that's happening in the corners. So my recommendation is to embrace that, because again, the aesthetics should look very natural. You don't want to have, a 25-year-old's hairline, which is super flat, let's say, or a 21-year-old's hairline, and you're 50 or 55 or 60.
You want to look like you have a good 50, 55-year-old, 60-year-old, 70-year-old head of hair. A good head of hair, but age appropriate.
Right. And you did touch upon it. So ethnicity matters and goals matter, right? So if you are going to, do edge ups, and that's a very popular style, then that changes everything. Then at that point, you don't want a receding hair, like a natural recession. You want a straight or edge.
Or even like it's more common in people of like Asian descent to have a different pattern hairline, whereas that same hairline in a Caucasian individual looks more traditionally feminine. Basically.
Right. So take pictures with you to your consultation so that you can portray that message, and inquire with your surgeon or the practice that's doing your surgery, what level of experience do they have with your hair type and your demographic. That's very important. So I'll let you take it away, because it's very different for female pattern hair loss and correcting hairlines from that front.
Yeah, for female pattern hair loss, there's a lot of different, it's the same for male too, but there's a ton of variation in the different patterns. So you can have like the M kind of shape. So you mentioned like widow's peak, you think of as a sign of recession for a lot of men, but there's a lot of female patients that naturally have that hairline. So like a common example is like Kourtney Kardashian has like a pretty noticeable like widow's peak.
Right. And if you're watching on YouTube, we're going to like post these photos so you can get visuals.
And then some people will have like a more like rounded hairline. So sometimes that kind of where it's just all kind of round and connected. And then a lot of people will also have like this part come out like mine kind of does. Like it comes here and then that part comes out.
Yeah, your temples.
My temples, yeah. And there's all kinds of different patterns. I mean, part of being a good hair restoration surgeon is staring at people's hairlines just to see all the different, so we can like group it like, oh, there's 3 patterns or 5 patterns or 7 patterns or 10 patterns or 15 patterns, but really it's like there's endless patterns and you really need to be analyzing
I'm sorry. I started laughing because we talk about this all the time. Every time we meet someone new, my eyes automatically gravitate to their hairline, and it's like, oh, put your eyes down, like meet eye to eye. So I'm always like constantly telling myself don't stare at people's hairlines.
Right.
But yes, we constantly do it because this is our work, our passion.
Yeah, and so a lot of times for me it's like following kind of what their hair was like or what their hair is like. If there is hair there, it just needs to be increased in density, coupled with their concerns. So it's like if there is some asymmetry that they want to try to improve, we can improve on it. But I usually will, and unless it's a very special case or hairline, usually I will try to convince them to keep some degree of asymmetry so that it is natural. But again, for me, it's like I really try to follow what they naturally are doing as much as possible. With the so you mentioned like transgender patients or non-binary patients who want to feminize or masculinize
or
their
even keep it
hairlines.
ambiguous,
or keep it so that would be an example where obviously you can't follow what's there. You need to work with them to understand what they're wanting and then create that.
Right, because those are freehand. So again, stencils are not necessary and not necessarily the best thing with hair restoration surgery, particularly hairlines. So then let's unpack the portion where we were talking about asymmetry, right? And so naturally, and there have been studies on this, that there is a level of asymmetry on a natural hairline. And I think the study showed about 86% of individuals have a little bit of a higher recession on the right side compared to the left, right?
Okay, we'll have to pull that study and see.
Yeah, I think it was presented in the Hair Transplant Forum. It's a pretty old study. But that one resonated with me because a lot of times patients say, well, I want perfect symmetry. And I have to explain to them a little bit of variation, not gross variation. A little bit of variation is very natural and will add to the final product. And then they start understanding. But then going from there, let's talk about macro and micro irregularities. Because a lot of times we see folks with poor hair transplants, and I say poor in that it wasn't the lack of growth. They have growth, but when you stare at the hairline, it's just very straight. And so what is the importance of macro and micro irregularity? Can you explain that?
Basically leaving, so macro irregularity would be not having like a straight line, but having like areas where the hairline comes down more or less. So kind of like that overall kind of irregularity. So like it's probably easier to show your hairline. Like you naturally have areas that come down.
Up and down.
Yeah. So that is usually what looks the most natural. So having that degree of irregularity.
Right.
And then the micro irregularity is going to be not like when you are making the sites, the holes where the hair is going to go, not having them all like perfectly lined up, right? You need like some. So again, if you look at your hairline, it's not like a straight line of there's some hair coming out in front and then, behind that, in front, behind, all
Right.
varying kind of
Right.
position. So you want to pay attention to that, because if all the hair is coming out in a like all together in a straight line, that looks very unnatural. And then the person that we trained with, Dr. Matt Levitt, also really reinforced the concept of cross hatching beyond that at the level of the hairline. So there is a natural direction that most of the hair will follow, and we always follow that. A lot of times that's coming kind of forward, but if I look at your hairline, it actually looks like the hair's coming out over here to this side. So usually, again, I follow the natural pattern. I don't just follow a template or a rule. I follow what people are doing naturally. But you wouldn't want all the hairs coming out. So like if you look, some of your hairs are like slightly coming at a different angle. So having some irregularity even in that like direction, not too much, so it doesn't look, really crazy and it's not too difficult to manage, but a little bit of variation there in some of the hairs too, just to add another level of depth and naturalness. And it also can help with kind of the illusion of more coverage, basically, too.
Right. So you touched upon a few things. So beyond the micro and macro irregularity, one of the things we always talk about with patients are the three components or metrics that are very important when creating hairlines, and that's direction, angle, and density, right? And so let's go deep dive into each of those, right? So you've touched upon direction and kind of angle. And so a lot of times folks will have variations along their hairline with cowlicks, right? We know them as directional or pattern changes. Not everyone will have, it'll be varied from patient to patient. And so it's important to follow those, especially if there are some remnant hairs there, because every new hair we transplant should follow an existing pattern, and that changes even along the hairline. The time where you can create kind of blank canvas is when it's blank. When there's nothing there, then as a surgeon, we have a little bit more leeway to go straight and kind of almost even kind of converge, go like a little bit more central so that we can cover more ground. Angle, very, very important. You should not have hairs that are sticking up straight, especially along the hairline. As you are anterior or forward on your hairline, it should be facing outwards, or rather angled outwards. And then as it goes a little bit further back, that angle goes a little bit more upright, but not 90 degrees. And then density. So I always explain to patients, I can put your hairline wherever you want. I can bring it as low as, your forehead. But that's inappropriate because...
You can. You maybe
but you shouldn't.
Like,
I could put it anywhere. But the more important thing you should be asking for is, where can I get maximum density? And can that density match my control? And the control in this scenario is the surrounding hair that has less hair loss. So I always look at the sides and behind where, if they don't have hair loss, that's what we want to try to mimic and match.
But you want for it to be a natural transition for the eyes.
Exactly.
So it's like creating an illusion of enough density while being strategic with the amount of grafts that you're using.
All right. So topic of density, right? Very, very important topic. A lot of people do not understand what that means, but what does it mean to you?
Density, you can either be looking at the follicular units or grafts per square centimeter, I'm going to define it, or some people also, when they say that, they mean like how many hairs per square centimeter, which if you have multiple hairs in a unit, then that's going to be higher than the graft per square. But basically, it's how much hair you have in the area.
Right.
But that can be really important in terms of getting enough coverage. So basically, the density, which is how much hair there is in the area, coupled with the diameter of the hair, is going to determine how much coverage of the hair that you get.
Right. And so
coverage of the scalp.
Right.
Yeah.
And we want to maximize that in most cases, especially along the hairline, right? That's like the most important part. So most surgeons will transplant higher densities in the front and along the hairline than, as they go further back. And every case, is variable, but generally that's a steadfast rule. So that's more important than a lower hairline and sparse coverage, right? So density, density, density. Keep that in mind.
Yeah,
right?
and that's a really good strategy, is like to really prioritize the density at the hairline so that that looks really strong. And then most people will lower the density farther back, as you were mentioning.
Now, we did touch upon direction and angle kind of for the hairline, but we should give a little bit of a caveat to how it should be approached on the temples, which are the sides, right? So we generally say, hey, the top of the hairline is the top frame of the face. The temples, which are the sides or the side frames of the face, those angles
I've
become.
actually never heard that before.
Oh, I say that all the time.
Yeah, that's
it's just
cute.
like your eyebrows frame your eyes. To me, that the
Yeah,
hairline
I think,
frames
I
your
mean, I
face.
think of like the hairline of framing the face. I've just never thought about like the top and the sides of the frame.
There you go.
That's very cute.
We're also learning things from each other all the time. But for me, it's very important to not mess this up, right? So I generally say, hey, don't touch it unless you really, really need to, because the type of caliber of hair is very, very important. It should be very delicate because on, for example, our temples, we haven't had surgery, as an example, or most people that don't have surgery, those are the thinnest hairs possible. And, most of the hairs that we pull out will likely be thicker than that. Also, I've seen a lot of work where, unfortunately, it was placed at an angle that comes out, juts out a little bit too much. So it should be very, very flat. And the direction should follow whatever natural direction the other surrounding hairs are going. But the biggest reason why I kind of tend to say, hey, don't worry about the temples as a first-time procedure in a lot of cases, unless appropriate, is that if you're not stabilized and you're going to have some receding on your temples, well, we'll have transplanted for today and now in the present, and then you may lose some of your natural hairs behind it, and then you have a gap, and then more hair behind it. So that is something to also understand.
For your younger patients.
Right.
Yeah.
Right. So all in all, I mean, those are the very important components of hairline. Is there anything else you think we missed?
I think I touched on it, but just, again, there's like all these different things that a good surgeon should be considering as like a patient. I think it's hard to know, and like someone might say something different, and I think that's okay.
Yeah.
I think the big thing again would be like looking at before and after photos and what their hairlines look like, because there's different, just like how in the cosmetic dermatology or aesthetic, like injectable, Botox filler, that whole kind of thing, different people have very different aesthetic eyes. Like what I might think looks like horrible lip filler and is really unnatural, other people might think looks good, right?
Right.
So you have to look at like before and afters, because like you need to see what they think looks good, because what they think looks good might not look good to you, right? So that's
Right.
not a good match.
Right.
So the same thing here is like with before and afters, if you're whatever kind of work you're getting done. So if you want to get hairline work done, you really need to look at those hairlines, because if they're showing you before and after, they must think that's a good case. They're not going to show you a case they don't think is a good case.
Right.
You really need to make sure that you also agree that that looks good, that that is ideal, that that is the kind of aesthetic.
Right.
So like, for example, if you want a really low, unnatural hairline, you wouldn't want to come to us, because we like age appropriate, natural looking hairlines. And there are cases where, again, like a low hairline or it being crisp in the appropriate setting, a lot of it can be ethnic variation, that kind of thing can be appropriate, but we're not going to do it where it's inappropriate.
Right.
So somebody who, in my opinion, inappropriately wants their hairline like down to here and like a crisp straight line is not going to be happy with our work.
Right.
So I think that's where like looking at before and afters can help you kind of see, is what you think looks good what the surgeon thinks looks good.
Right. For sure.
And you're a good match, basically.
For sure. One of the topics as you were speaking that also popped into my mind that we should definitely talk about are the types of hair follicles that are placed along the hairline. And we've seen, a lot of folks with 3 and 4 haired follicle or follicular units, grafts, multi-haired grafts present along the hairline. And the problem there is, in most cases, naturally, that's not the case. It's generally going to be a soft transition to thicker density as you go further back
Right.
in nature. So in order to achieve that with the highest degree, one of our policies is we only want single hairs in the front. Now, you can have very, very, very delicate two-haired follicles in a natural hairline as well. But because that's very difficult to standardize, a lot of good surgeons will avoid putting any multi-haired follicles in the front. So that is one of the things you should request and confirm that your practicing surgeon, pays attention to, so that you're not left with, a thick hair that people's eyes gravitate to when they talk to you.
Some funky hairlines, unfortunately, where people have like 3-haired grafts coming out and it catches the eye.
Yeah.
And even like when you were talking about like the temples, like then you want to try and use hair that tends to be thinner, like from the sides versus like the very center and that kind of thing. So, just making sure that they're going to be using the appropriate type of hair in the right case. And if you're going somewhere reputable and experienced and that pays attention to detail and isn't just trying to crank out a lot of volume, hopefully they'll be doing that. But yeah, it never hurts to confirm.
Right. And I think that's, puts a wrap on hairlines. It is a very, very good start for you to kind of understand the nuances of what we spoke of. Definitely discuss it in detail with your surgeon and their team, because that's the thing that people will see when you have your transplant done. And that's the thing that is very high stakes. And so you should be very comfortable and have an understanding that, hey, realistically, this can be the result that I'm looking for in doing this process. And if any of that seems like a red flag to you, go back to the drawing board and figure it out. So that wraps up episode 6, and we look forward to the next one. Oh, this is where I say, this is Dr. Kash. I'm Dr. Roopani. See you next time.